Africa's political, social and commercial decisions are driving the climate and health crisis on the African continent. Infectious diseases still account for a large percentage of deaths on the continent. Age-specific mortality rates from chronic diseases are believed to be higher in sub-Saharan Africa compared to other regions in both men and women. The World Health Organization estimates that deaths from non-communicable diseases are likely to increase globally by 17% over the next 10 years. Let's discuss this with Africa's risk outlook when it comes to health. We're now joined by Dr Chris van Straten from International SOS. Thanks very much for joining us, Doctor, and welcome to the show.
Thanks so much for inviting me. Absolute privilege to be here.
It's a pleasure. Talk to us about what health promotion is and how it can be done for the sustainable development of the African continent.
Right, so it is multi-layered and it's going to be, I don't have too long to answer it, but it has to be looking at the SDGs and that global picture. And that's what the World Health Day is about. If we have a healthy planet with healthy air, healthy water, good food, then our health will improve and benefit. And it's really important, as you said, with the non-communicable diseases have, I think, to a degree, been a bit neglected during the pandemic. And we are picking up more cases of diabetes, more cases of uncontrolled hypertension. And I think we just need to focus in back a bit on the conditions that were concerning us before the pandemic and making sure we don't take our eye off the ball and manage it holistically.
And I mean, you speak of issues that are actually preventable. I mean, when you're talking about diabetes, for example, this is something that, you know, with the kind of healthcare that we have, you know, people are able indeed to do something about it. Why are we still struggling, particularly in sub-Saharan Africa, with dealing with some of these diseases?
Really good question. And step one, I don't think it's just sub-Saharan Africa. I think it's quite a global problem. And I think it's interesting to note how it's a lifestyle problem. So during the pandemic, I'm going to speak for myself, my level of exercise certainly decreased. I was certainly taking comfort eating. And the problem with that is one can and will pick up some bad habits, pick up weight. And it's the lack of exercise. It's the lack of good, nutritious food that can then lead to or exacerbate diabetes. I think another impact from the pandemic has been that people haven't always been able to access easily the screening they would normally access. So they haven't been able to follow up at the diabetic clinic or been able to follow up and get their medicines. And reports coming in over the last 2 weeks, we think that part of long COVID could be an increase in type 2 diabetes, and that's concerning. So again, we've got to put it all together, and it has to do with how we live, how we eat, how we exercise, and accessing healthcare.
Yeah, and it's interesting that you talk about COVID-19, and I mean, maybe that's a good point to start in terms of talking about what what are the health threats lurking in the shadow of COVID-19. I mean, you know, we already had problems before COVID-19, but it seems that those problems have increased somewhat due to the fact that we had COVID-19. I mean, you talk about the fact that, you know, people were exercising less, taking care of themselves less, comfort eating. A lot of us are guilty of that, of course, But what are some of the major issues that are now lurking as a result of this?
Yeah, that's a really good question. So mental health, I think, in many regions was a concern, but there was a sense that people were talking about it, people were getting support, and businesses were talking about it. During the pandemic, I think it's exacerbated the stress of lockdowns, the stress of this pandemic and what it might mean for individuals, business companies, really, I think, has exacerbated mental health for many people. So that's definitely been lurking. We also know that, as we said prior, some of the non-communicable diseases, and specifically I'm thinking of cancers. We've been reading scientific journals the last week where they've said it appears that a lot of people did not go for their annual checkups. They didn't go for their cancer screening. Yeah. And here's an important thing. If you get cancer and you pick it up early, we can often treat it successfully. But if you don't pick it up early, then it can be catastrophic. So I think that's where we've missed, and potentially could take our eye off the ball. We need to refocus. And then when it comes to the screening and continuation of care, that's critically important as we move towards hopefully the end of this pandemic and making sure we keep South Africa and Africans healthy.
Yeah. Doctor, how can African governments, and I wonder if I should just be putting it on governments, and probably I should be talking about people like yourselves, who are, in the healthcare sector, but what should, let's say, governments and all those involved do to bolster, investment in research and development, innovation and manufacturing on the back of us dealing with the pandemic? And let's not forget, we're still actually in the midst of the pandemic.
Yeah. Okay, it's a great question. Again, it's really big and it's really complex, and there are smarter people than me looking at the problem. So if you look at the beginning of the year, Cyril Ramaphosa and Sun Xiong, who's this billionaire South African who went to America, made his money in biotech, has done extremely well, and he's coming back and going to help build centers where we can make our own vaccines. And that is critically important. Remember, we've done amazing things in South Africa. We've got great technology, great scientists. We picked up, members, we saw the different variants in the pandemic. We picked up some of those first variants and alerted the world. So I don't think we should underestimate the strength, resilience of South Africans and our scientists. And I think we also need to, but we do need to be clear, it has to be a collaboration. Government, private, me as an individual. I got vaccinated and boosted to protect myself and my loved ones and people at risk. And it's all of us together that we can actually, I think, make these differences. It can't just be government.
Yeah.
It has to be me as an individual and the government and different institutions in private.
Yeah, certainly a collective effort. Doctor, it was such a great pleasure having you on the show, and we hope to catch up with you at some other stage. Thank you, sir.